Welcome to Creative Health Tech, your dose of strategic creativity from the minds push the boundaries of the health tech industry. We are your hosts, Felippe Silveira and Marques, founders of MOE.
And in our very first episode, we are thrilled to dive into how human-centric design approaches are shaping the future of mental health tech. Joining us today, we have a very special guest, Annamaria Greco. She's the head of design at Koa Health. Annamaria, welcome to the show.
Thank you for inviting me.
To start, we would like to hear a little bit more about you, about Koa, and the work that you do there.
Yeah, so let's start first telling a little bit about Koa. Koa Health is a digital company that focus on using design and technology to improve mental health. I'm working there as a head of design. I lead an amazing team which where we make sure to handle everything related to UX first. So user experience design and thinking in mind always the user need. So the main goal of our team is like being sure that our products always put the user first, focusing on usability, accessibility, and overall customer satisfaction. So this is
Nice.
mostly what we used to do there.
Nice. And you didn't start working in healthcare and health tech with design, right? I believe you have like previous experience before joining Koa, but what led you to this kind of industry, this type of industry, and especially like what you see as being the difference, for working in a company with Koa with those focus that you said in comparison to, let's say, other more traditional companies, if you can say like that.
Yeah. So yes, as you said, I've been working in other kind of companies, especially advertising agencies. I studied like more generic communication design, like more than 15 years ago. So it was another world, basically.
Yeah.
The first smartphone just, I mean, uh,
Really another work.
yeah, definitely. So I really couldn't imagine that I could ended up working in this kind of environment, making application, designing for application. When you study, you know what you want to do, but you really don't know until when
Mm-hmm.
you are out there. I mean, at least for me, it was like this. I didn't know exactly what I wanted to do and which kind of environment, because you really don't know how many environment and field can be out of there. So I started in advertising agency just because I had this opportunity at the beginning. And I mean, when you study communication design, thinking about advertising agencies and these famous agencies look like, wow,
Yeah.
exciting.
Yeah.
And it is like this at the beginning, but then you realize that you are making advertising. And
Mm-hmm.
so it's just this. And you are like creating a need that is actually not a real need sometimes,
Mm-hmm.
not always. So after years working there, I was like missing a mission somehow
Yeah.
inside myself. I wanted to do something more meaningful with a mission driven focus. And I've been also quite luck because I found this job in this environment, and I moved from advertising agencies first to a little studio where we were touching more this kind of things.
Yeah.
And I worked in this small studio for health related project. And then with this base, I've been able to do the step up, moving to a company that was doing and was like mission driven focused in health stuff related. I mean, in that moment, I really wasn't sure about what it means. I mean, I had an idea, but when I then started to work for real in this kind of field, I really felt much more I mean, satisfied. And I mean, I was using
Yeah.
my skills for helping people, and this is what we currently try to do, helping improve people's health and lives. So now that once you are there, it's hard to
Mm-hmm.
imagine stepping away. So
Yeah, because now like you can find the purpose in the work that you do.
yeah,
And
definitely.
even like if you have to tackle bigger challenges, it doesn't matter because you know that like you're doing this just for like an advertising to be shown in, I don't know, like in the street or in the Super Bowl.
Yeah,
Like
yeah.
you're trying to help people.
I mean,
And
also in
interesting.
advertising, sometimes you do this, but not always. I mean, the purpose is a little bit different.
Yeah, I would say it's interesting like this path, as I heard from many other people as well that went to healthcare, health tech, or like more mission driven industries, if we can say, that many started in advertising. Like you said, you see those big companies, those big names, big agencies, and feel like, oh, that's exciting. And it is for many people. But I believe there's one point in our careers that we just don't want to just doing the work for the sake of doing the work. We want to make sure that what we are doing is being effective for the
Yeah,
good, if we can say that.
yeah,
Of course, every company, they have their businesses interesting in the end, but I feel like with the health tech, w- helping a company like Koa, for example, to succeed, we know we are making impacts on other people's lives, and that's also like one of the drivers for us to actually focus in this space as well, and the love and passion for be able to contribute to big products and get this to reach more people and get them to be impacted by that.
definitely.
And and at Koa, you're now the head of design, right?
Yes.
But I know you didn't start right there, right? So I know you started below that, and you made your way to head of design. How actually your role shifted and changed throughout your career at Koa, and like what you'd say are some responsibilities that when you joined at first you didn't imagine that you have, and what are the challenges that you face right now, like leading design at Koa?
Yeah. Yeah. So I started as a product designer and visual designer, and I learned a lot. I learned a lot regarding UX design and UX design related to mental health products. I mean, it's hard to say because I really need to think behind and all the path that I've been gone through. It's I mean, if it think as I think about it, it's quite amazing all the learnings that I got. It's hard to explain the shift, how it happened, because it was quite natural. And I mean, we start also because the company has been changing during these years. I started working on a single product, and then we moved to like to build a family of products, and now we have
Mm-hmm.
one main product which like collect all the others little projects that we have inside. So I think that my learnings there as a product designer, working first on the little piece, helping
Yeah.
me then moving on because I was growing with the company somehow. And
Nice.
I think that I grow with my company, making this shift in my career from product designer, lead product designer, and then finally,
Yeah, because when you joined Koa, was not at the size that it is today. I think it
definitely
was more
not.
like
And
more a startup
it was a startup,
structure.
and also the products were not what. Well, it was a startup, so we basically I started almost from the beginning. So I really have seen all the change, and I can see where we are now. And I mean, probably the big challenge that we have, and we always had during these years, has been like making people trusting us and making them feel like they are in a safe space when they are using our
Mm-hmm.
app. They are giving us data, personal informations. They need to
Yeah.
trust us, and we also need to give them I mean, we also need to transmit this sense of transparency to them when we are building our product. So we take a really care about their privacy. In our privacy policy, we are always trying to explain all the consent that they are giving in a very clear way. And so, I mean, this is the big challenge. Make them feel like I'm trusting you. I'm giving you not because we are using their personal information, of course, but I mean, we also need to give them some personalized plan in therapy. So we need to
Mm-hmm.
have
Mm-hmm.
something to give them back. Um,
There's an exchange,
yeah, somehow.
on that.
Yeah,
But at the
and
same time, we need to be transparent, and we need to be sure also that we are keeps safe their data and all their information. So it's something in between.
privacy, safety, all those kind of things are really huge if you're dealing with health. But my question is more like, how do you feel like you address this with the usability? Because like as the head of designing, I feel that like you're also trying to understand like how can I make this feel a little bit more supportive? How can I make this app a little bit more something that they can trust, as you said?
Yeah. Well, first of all, we do a lot of user testing. This is our first tool that we have. So we do a lot of user testing, and we learned a lot also about this. I mean, I remember the first times that we were doing this kind of user testing. This was one of the first insights that we got. We wanna be sure. I'm not sure if I want to reply this answer because this is on that. So I mean, we learned a lot, and we learned that we also need to be really clear about everything. And yeah, I think the user testing is the most important thing that we can do. And then, of course, one other very important thing is that we are working with clinicians. So I mean, our products are different compared other products. I mean, we are giving these products to people that could suffer a different kind of disease. They can be depressed, or they can suffer anxiety. So all the actions that they take when they tap on a button or another
Mm-hmm.
is not like any other kind of thing. I'm buying, I'm purchasing
Yeah.
something, or I'm booking a flight. It's a little bit different because it implies really how can they feel. So we work together with clinicians, and they help
Hmm.
us with that. Um, so user testing plus the help of clinicians, building the therapy, or even writing a sentence. Everything
Yeah.
is super important, even a word.
And any when it comes to like mental health companies, like, and I know like communication is a big thing. Like this, like you're saying, like it's something that is very sensitive, and we need to communicate in a way that not only builds trust, but also that people feel safe, especially that we don't trigger wrong emotions and feelings or anything like that. How would you say that you and your team use like design creativity to help make this process, this communication easier or smooth or softer, if we can say, for the patients, for the users? Is there anything in particular that you remember, or anything you did, recently or in the past, any change that you felt like by going this direction, we helped make this clear, or helps like users to feel the trust? Is there anything that comes to your mind when it comes to this?
So in general, everything we do is going in this direction. So even, I don't know, making a button with rounded
Mhm.
corner rather than
Yeah,
with
the
that
sharp
corner,
part. Yeah.
it makes the difference. So I mean, I can think an example. I think that even adding illustrations in a particular style can help. For
Mm,
instance, I remember this is thinking about how a user can perceive even an illustration in this kind of uh, environment. I remember a user test that we did with a user who was suffering of BDD, body dysmorphic
mhm.
disorder. I remember we were using a different style in the illustrations, like more without proper proportions. No, maybe we were showing a character with a big head and
Yeah.
this kind of stuff. I realized in how even an illustration, how much is important to design an illustration in a particular way when you are talking with a person who is suffering of a specific
Mhm.
disorder, in this case BDD. And I mean, because in their mind they could perceive their proportions wrong
Yeah.
of a
Yeah.
particular thing of their body. This was affecting the way that they were reading the content somehow that we
Exactly.
were.
Yeah.
So and we
In
decided
this
there
case,
to.
you mentioned, Anna Maria. In this case, of like this person and the illustrations, did you felt that those illustrations you're using with like different body proportions was it like beneficial for this person, or was
Was
this like
not.
something that you saw that you need to change and adapt
No,
to?
we really we saw because we. I mean, it was a specific moment where we were like make all the applications consistent between them,
Hmm.
and we decided to go with one style, which was this one. Well, we decided it was an option, but
Yeah,
then we realized that we were selling a therapy for BDD people that were suffering from of BDD, and we were like, okay, so be careful about this because this could affect the way they are perceiving the application and all the
hmm,
content. So I was then an option that well, we definitely didn't go into that direction.
yeah.
And just for BDD patients, we decided to use a different style for the illustrations. So in everything we do, we try to think to the user that we had there.
That's
And
interesting because it kind of goes back to what you said about like making sure that the user is there and it's feeling that kind of supported and that like they can trust, because at the end of the day,
yeah,
when they are reading something from you, they are kind of like, if you have an image, they are attaching that image to your brand. And if they have a wrong reaction, like a negative reaction to that character or that photo of the person or anything, this is definitely going to come back as well, like how they perceive you and how they trust
yeah,
the information that is being presented. So this definitely like helps them to feel at ease and receive better the message.
yeah,
That's very interesting. And
definitely.
like testing, it's super important. Like I remember like before working with animation, I used to work with UX as well. And I remember then when I did my first user test, I discovered that I knew nothing. Literally, like everything that we failed, they're like, "Oh, that's super clear." But no, like that's the right direction. Like we had to basically review the entire app,
Yeah, yeah, yeah. It's
because
exactly like this.
yeah, because like we are so used to technology, we are so used to all of this, discussing all of this, that when we get somebody that is not used, it's completely different perspective. So for me, it was really eye opening. So
Especially because when we are creating, we make a lot of assumptions of like, oh, we're
Uh,
gonna make this because this is gonna get people to understand that way on this way, and we might have a lot of right assumptions, but sometimes it might be wrong, and the only way to discover is actually getting people to interact with what we create, what we design, and especially like if we can get the actual users of the app, so we can get the most honest feedback possible there. And I believe like also something that enables you to be able to adapt and like change the illustrations, for example, that you mentioned, is because I know you always had a focus on creating, your develop your brands in a way that is like where you unique to you and your customers. So use more of like custom illustrations that your team creates than
mhm.
just let's say just buying assets out there, right? Like, because
Yeah,
I see
yeah,
even like some big companies, some huge companies, I see many of them with like some stock designs and stock illustrations, which like look nice, but
yeah,
doesn't doesn't say a lot. And
yeah,
I know Koa is the other way around. You develop, you create like your all of the designs, illustrations are all custom made, right?
yeah, yeah. It's exactly like that. I mean, especially because we have this special people out there. We need to be careful about everything, even I mean, illustration that are definitely very important.
Yeah. And are there any, let's say, rules you and our team they use to keep this coherence, between like your brand storytelling and the visuals and the UX? Because of course, I know as being creative myself that sometimes we want to do a lot of stuff because we like doing and creating stuff, but we know like we have to set some boundaries as of course what our users are giving us as feedback and what they demand as well, but at the same time making sure everything you create supports the brand narrative, brand storytelling. Are there any kind of like main rules or main guidelines that you and your team you have to make sure everything you create is aligned with the brand?
Yeah. So first of all, we keep in mind the core values and missions. So we always keep in mind that we need to focus on things like empathy, support, inclusivity. And when we start on a specific product, we have specific brand guidelines for that product, um, which are of course part of a huge family of the big family of the brand guidelines of Koa Health. And but it's true that, well, it's not an easy thing because we have different products which are part of one main product, and then we have also the brand identity of Koa Health, which I mean is another thing.
Mm-hmm.
What we used to do is for keeping everything aligned is making these brand guidelines very clear, and then being sure that also the design system of each product, actually we are moving in a one big design system, which will apply to all our products, so we are sure that is everything is aligned, of course. And there are also other people that and stakeholders that are working with our materials, and if not with our specific materials, with I mean correlated materials that needs to be consistent. And we are sure we try to be aligned, and we do like between us one-to-one meetings,
Mm-hmm.
brainstormings all together. So to keep everything consistent, we really try to work together as much as possible, work
So the
closely.
consistent efforts for the team
Yeah.
to make sure everyone is on board, everyone has a clear vision and path to follow.
Yeah,
And also,
definitely.
like you have been there for a couple of years, and you have grown from the product design to the head of design. Do you see a lot of the brand and the usability, like and the like the tests that you do and the choice illustrations that you have for like? Do you feel that they kind of one inform the other? Like maybe the brand leads the design of the app, but then during the task you see that there's another direction, and this ends up kind of informing the brand back. And like, do you see that the brand has shifted with the movements of how the apps like change and grow as well?
Yes, definitely. It's like a work in progress.
It's a never ending work in progress.
Continue
Yeah.
work in progress, and I mean it hard. It's an hard thing, to be honest, because I mean we have customer out there that are looking at Koa Health, and then we have users that are looking and using our product.
Mm-hmm.
So I mean we need to find the right balance between the two things. It's not one thing that is leading the other. It's it's definitely sure that the app needs to be used by the user and needs to
Yeah.
work and needs to be they need to understand it, and also the colors and everything, because we know that colors are generating also feelings,
Yeah.
and it's an interesting challenge.
Yeah.
And in the end, like I said, brand is a work in progress that is like gonna be forever, and it's just I feel like it's important that you and your team you take it this way. No, not just think of like the brand as like, oh, that's the brand and that's the only
No,
way
no, no,
it
no, no,
has to
no,
be,
definitely, definitely. I
especially
mean,
like,
on both sides, we try to work in parallel, we try to be consistent, but it's not one thing on top of the other. I
oh,
mean, also
that's awesome.
the users are different because I mean, the users of the products are our users, and then there are
Mm-hmm.
customers of our brand. So yes.
Yeah, because like the industry has changed so much in the last few years that it doesn't make sense for you to stick with something and don't evolve with like all the new options. And also like because now we have new technology that is being adapted way more fast, but
Yeah, it's
also
going so
people are
fast.
being way more open
Yeah.
to the new possibilities. So if you don't keep evolving as well the brand, you will eventually fall short.
Yeah.
Yeah.
That's
And
exactly it.
like thinking about like all things that have changed the last few years, how do you see like what are your thoughts about like what do you expect for the future of mental health? Both like in terms of design, but also like as an industry, like how do you feel that it has been changing it?
Well, what we would do is for sure continue making interviews to users to understand more and more their needs. And what we are trying to do at Koa is shift people from reactive care, which means like they are seek for help only when they are in crisis, to a proactive approach where they focus on prevention. So the continuum care. This is like our main goal. Just like when we have seen a big change on how people take care of their physical health. I mean, now we know we see that we are taking care more of our body, eating healthy
Exactly.
food or exercising. In same way, we want to change the way the people are managing their mental health. So we need that this implies a behavioral change. And this is definitely not an easy uh, goal to reach. We are working on it. I mean, but we know that there is still a long way to go. So, yeah, I think that this is what we want to do. And the way we will make it will for sure be aligned with I mean, the improvements on the technical side also. I mean, thinking AI or this kind of stuff. So
It's nice that this conversation about this preventive healthcare than just disease healthcare. This is something that we've been hearing a lot in the past months in conferences around the industry and so on. And I think that's a big shift that we're gonna see definitely in the following years as like treating people and not just treating diseases.
yeah,
Helping.
definitely. This is the mission, like try to make people really aware of it, because I mean, not everybody is thinking, and everybody is thinking that we need to take care of our body,
Hmm.
like going to the doctor and everything. But mental health is basically the same. It's just another part of our body
Exactly.
somehow.
Yeah, and
So we need to
it's
take
just that
care of
like
it.
it's hidden, so we usually
So
forget about it, which is a
yeah,
big mistake.
yeah, yeah.
So Emery, I think that's it. Like, thanks so much for sharing your experience with us, and also we
Welcome.
can't wait to see like what are the next design innovations in your team, what you bring to COA and the mental health care industry as well. What is the best way that for our audience to connect with you, where they can find you, if they want to reach out?
My LinkedIn is I regularly check it, so I think the LinkedIn is the best way.
Awesome. So thanks so much again. Thanks, Raff, for joining me as a host of the show, and thanks for you listeners. So don't forget to subscribe to keep up with our next episodes. And if there's something you'd like to see in the podcast, let us know at CHT, so it's Creative Health Tech at mode.studio. See ya.